Hello, and thank you for joining us for this spotlight on healthcare management from Massachusetts College of Pharmacy and Health Sciences. My name is Tim Ryan. I am one of the admission counselors, and I am here with Dr. James Goss and a student from the healthcare management program, Lauren Mastro Giacomo. So Dr. Goss and Lauren are going to help share some information, answer some questions that I have that hopefully will give you a little bit of a sense of what it's like to be a student in the healthcare management program at MCPHS. So I'll first have them introduce themselves and then I'll get right into the questions. So first you, Dr. Goss, if you could introduce yourself.
Hi, I'm Dr. James Goss, and I am the program coordinator for the Bachelor of Science in Healthcare Management. I have over 30 years of healthcare leadership experience, and I'm most of it though is on the emergency side of healthcare response to disasters.
Excellent. Yes, I've spoken with you a couple of times, Dr. Goss, and heard all of the awesome, cool stories you have with all of your wealth of experience. So it's fantastic. Thanks for joining us today. And Lauren, why don't you tell the audience a little bit about yourself?
I'm Lauren Mastro Giacomo. I'm currently a third-year student at MCPHS studying healthcare management, and I'm originally from Shrewsbury, Mass, which is 45 minutes outside of Boston, but I'm currently living in Boston right now.
Excellent. Thanks for joining us today, Lauren. Thank you both. So I'll get right into the questions. First question for you, Dr. Goss. Could you please describe the strengths of the healthcare management program at MCPHS?
Well, absolutely, and this is probably one of the most important questions because I've been thinking about this a lot since I came on board at MCPHS, and it's very important to me and to the university that we prepare our students for the real world of practice in healthcare management. And we want to make sure that they're knowledgeable of the language of healthcare business, of the systems and processes of providing care. And this can only be accomplished through what we call the practitioner scholar model of education. Because healthcare business in general, is messy, it's imprecise. There's a lot of ambiguity associated with it. So programs are very, very different. But this one, with the practitioner scholar model, we have practitioners that can transfer knowledge very effectively to students to prepare them to actually practice within that space. So I'm fully convinced that if a person really wants to make a difference in the lives of their fellow human beings, live a life that matters, this is healthcare management is where it is. I want to share one of my experiences, and that was in Haiti, 2010. After that devastating earthquake, I was sent to run a hospital in Port-au-Prince, and the hospital had over 400 people on the grounds that required surgery, and the hospital itself was not inhabitable. And I'm a licensed paramedic, but the skill I used and the knowledge I used was not my paramedic skills. It was healthcare management skills in order to get the hospital up and running. And we were able to achieve that in 5 days. So this healthcare scholar, the practitioner scholar model is the best way to educate our students and get them out into the real world of healthcare management.
Awesome. Thank you very much for that. Again, the fantastic stories. So thanks for sharing. First question for you, Lauren. Can you tell us a little bit about why you chose MCPHS?
Yes. So I originally, freshman year of college, I studied at Emmanuel College, and then I did some research in healthcare management and realized that they didn't have that major at Emmanuel, and I knew that MCPHS did. So I applied to MCPHS my end of freshman year, and I started my sophomore year at MCPHS. And I think what drawn me into it the most was just the diverse community and the location wise, just in the center of all hospitals, and just knowing that they're from Emmanuel and this experience, I definitely have seen a lot more that professors care and want to help you get to reach your goals and what you want to do after graduation. And also what drew me into this program was they had a master's program that I want to follow, which is directly after college, and they have it one direct specifically for healthcare management.
Awesome. Yeah, we're in a really great location, as you mentioned, in the Longwood medical area. So all sorts of opportunities that presents, as well as the opportunities presented by the college itself. So thanks very much. Dr. Goss, the next question for you. Can you tell us a little bit about what you enjoy most about teaching at MCPHS?
Well, yeah, for just, to be brief, I love it. I'm genuinely a people person, so I really care about my students, and love working with the other faculty, and staff. Uh, I originally applied here though because of a ranking. It was a Georgetown University study that ranked MCPHS as number 3 for return on investment for the students, and that is one of the drivers that got me to look at MCPHS. And then learning about CASE and all the other things that MCPHS offers, I decided to apply and join this team, and I have no regrets. I love this university and I love the people.
Excellent. Yeah. With CASE being our Center for Academic Success and Enrichment, we're a very student-focused institution. And I think that's very clear from all that you hear from these major spotlights and all of our other recorded sessions. Next question for you, Lauren. Can you share some examples of how your program has prepared you for your career in healthcare?
Yes, there's 2 things I want to highlight. So one of them is the career exploration course I took my sophomore year. And although it was only a 1-credit course, it taught me a lot about just jobs after college. And we learned how to build our connections on LinkedIn, connect with other MCPHS alum, asking their experiences and where they're working now and how they got their internship. We made our resumes, our cover letters, and by the end of the course, we were able to apply to real life internships and talk with our professor on how to approach the, if we got the internship, and interview, and what to do with all that. And I also wanted to touch up on CASE. Just applying to other colleges when I first started, I noticed a lot of them didn't have things such as CASE, but with CASE, we actually get a counselor who I've seen a few times, but they really help you with time management skills and study skills and how to make sure you meet your deadlines and on time, just set you up for success.
And you're connected with that counselor from the minute you started MCPHS, the
Yes.
same person all the way through, right, Lauren?
Yes.
Which is really helpful, I think. And you have a faculty mentor in the same light that's assigned to you from the beginning and with you through the end. So I think that is one of the great sort of aspects of the MCPHS experience. I'm glad that you're benefiting from it already. The next question for you, Dr. Goss, can you provide some examples of accolades and achievements from the faculty in the healthcare management program?
Yes, absolutely. Our faculty scholars are very well published, and we are recognized as experts in our area. And also, I'll start with Dean Spooner, where he is the dean and is very busy, but still finds time to sit on the patient education committee at New England Baptist Hospital, and he co-chairs the patient advisory council. Our faculty have a long list, like I said, of publications, and are leaders in the field. I'm going to read this about our executive in residence, Dr. Helen Figge. Becker's Women to Watch. She was one of Becker's Women to Watch in Health IT in 2020, and 70 women leaders in Health IT to know in 2020. Health 2.0's 10-year industry leader. Health Data Management's Most Powerful Women in Healthcare IT, and Becker's prestigious Women to Know in Healthcare IT. So our folks are very well published. Like I said, they're seen as experts in the field. In fact, some of them, the books they teach, they're the authors of. So there's a lot to be said about the scholarship side for our faculties.
That's a sign that you know that your professor is legit when you see that they are the author of the textbook that you're reading for the course. So that's fantastic. Thanks for bragging a little bit about our faculty. The next question for you, Lauren, we talked a little bit about that career preparation that you've been doing already. Can you talk a little bit about your plans or your goals for following graduation?
Following graduation, I think I definitely want to pursue my master's, but I also want to be working while pursuing a master's, but I'm definitely not sure where I want to work or exactly what my title, but just getting involved now with internships and volunteer work is helping me guide that direction after graduation.
Awesome. Thanks. Dr. Goss, next question. Can you talk a little bit about any additional opportunities or tracks within MCPHS that healthcare management students might want to consider?
Well, I would suggest and in fact, I encourage students to choose a minor that is a complement to their healthcare management program, such as organizational psychology or any of the other majors or minors that we offer at the university or at the colleges of the Fenway.
Fantastic. Yeah, it's definitely one of those majors that we offer. The healthcare management major, it does allow for pursuing a minor, and it really does sort of supplement that education really nicely. So it's fantastic. Lauren, can you talk a little bit about your activities outside the classroom? So things like internships or volunteer opportunities, but also any clubs or organizations that you're a part of?
Yeah, so I'm currently volunteering and interning, but right now I'm volunteering at the New England Hymns chapter, and I work with other students from other universities such as Northeastern and Simmons, and we work together as a team and create just events and webinars and create slogans and flyers to get other students' attention. And we also have a webinar coming up this Thursday, and it has healthcare management managers and IT managers, and they're talking about how to get a job post-graduation if you didn't have a job, an internship, and just getting yourself out there. And I'm also interning remotely for Boston Medical Center, and I'm working with the program coordinator in the OBGYN department, and I help her with admin, the admin manual, rescheduling patient visits that miss their appointments, chart auditing, and whatever really they need me to help with during these times.
Sounds like a great internship. And whether the internships are in person or remote, we've heard of so many MCPHS students getting job opportunities, whether they be part-time or full-time for after graduation from those internships. And so it's really great that you're taking advantage of one of those opportunities right now. Last question for you, Dr. Goss. Can you share some examples of student outcomes from the healthcare management major?
Well, absolutely. We're a fairly new program, so we do not have a lot of graduates to date, and the ones we have had are most of them have gone to graduate school or in graduate school at this time. We do have one that went to who sits on the board of the American College of Healthcare Executives, and others that recently have job offers from, say, Aflac or other healthcare businesses. But the majority, I would say, to this point, we have very few graduates have gone on to graduate school.
Excellent. Yeah. So whether it's grad school or those real world opportunities, we're really preparing students for whatever's next. The last question for you, Lauren, can you share some advice that you might have for anyone who's watching right now?
Yes, definitely get involved early. Just the minute you start at MCPHS, try to get involved and network. And I think LinkedIn is very important when trying to build just your career and what you want to do, and networking with others. Definitely helped me find my internship. So I think it could help others find their internship and jobs after graduation.
Yeah, tapping into that huge alumni network that we have from being around for so long and being so well regarded in the healthcare field. So thanks, that's great advice. And thank you very much for your time, both Lauren and Dr. Goss. We really appreciate your time and your insights. Thanks to those of you watching. We really appreciate your attention. Congratulations on being accepted to MCPHS. As I said at the top, hopefully this has given you a little bit of information to help you with that decision about whether MCPHS is the right fit for you. If you have any questions or need any additional help, you can always reach out to us. You can email us at admissions@mcphs.edu. Thanks very much once again, and have a great day.